15% of the body fluid is lost. So you can imagine the severity. If we are unable to get the glass of water for 5-6 hours, we will become restless. So and here the patient is passing a lot of fluids per rectal. So calculate the severity. If it is mild, treat at the house. It gives excellent result. If it is severe, means total body fluid loss is 10 to 15%, then admit the patient. But while taking to the hospital, from house to the hospital, on the way, in the ambulance, you must give ORS orally. Because patient is continuously passing effortless, painless rice water stool. So better to replace orally, even if the patient vomits. So admit the patient. Then in severe case of dehydration, then start the IV line. How much IV fluids has to be given? The dose of IV fluids in adult is 110 ml per kg body weight in severe case. In mild case, 50 ml per kg body weight. So how to treat? Admit. Then try to get the bigger vein, access IV line. Then 100, because severe dehydration, no pulse, no BP. Only patient, sunken eyeball, hollow cheeks, scaphoid abdomen, urine may be or may not be passing the patient, but he is passing the stool. So start the large bore IV line. 100 ml of the fluid has to be given very fast. What fluid has to be given? Ringer lactate has to be given. It contains sodium, potassium and carbonate, lactogen. Ringer lactate. Lactogen is carbonate. It contains, so 3 types of fluids are available: normal saline, ringer lactate and diarrhea fluid. Diarrhea fluid also available. That has to be given, and 1000 ml of the IV fluid has to be given within first 10 to 15 minutes, or till the pulse becomes palpable. After the pulse is palpable, remaining 1000 liter of the fluid has to be given slowly for 30 to 40 minutes. So you have to replace at least 5 liters of the fluid. 5 liters. 5 liters means 10 IV bottles. One IV bottle is of 500 ml. So 1000 ml very fast, or till the body this pulse is palpable. Then 1000 liter slowly as a maintenance, till the patient complains of he is getting urinary sensation, urinary sensation. So this much of the fluid has to be replaced IV. Aim of giving the IV replacement fluid is to reduce the mortality less than 1%. Basically it is 30 to 40% mortality. So, and if the treatment is given in a correct way and during the adequate time, patient survives, 100% survives. So apart from the fluid, you can give what is called as oral fluids. You can at the same time, once your patient becomes alert, you can start the ORS immediately. So this starting of the ORS reduces the IV fluid again. So when the adequate IV fluids are given, patient becomes alert, pulse is palpable, body becomes warm, BP is recordable, and patient passes urine. So once the patient passes urine means that is the better sign. Once the patient means kidneys are functioning. Once the urine is passed means better sign, kidneys are functioning. Patient is 100% going to house. So you can discharge the patient once the patient is taking the oral fluids. So how to prevent this? Prevention is very simple. माँ बाप वही पढ़ाते जब से जन्म लिया मीन्स the water which we drink, it has to be absolutely clean. It has to be stored in a clean, dry container. Underground pipeline drinking water supply has to be there, permanent. Filtered water has to be consumed. So that water should not contain any bacteria. Number one. Number two is keeping cleanliness in and around. Third is reduce the number of housefly in the house by use of mopping of the floor with cresol, bleaching powder, whatever is detergent available in the house. And if during rainy season, if every year there is an outbreak of cholera, then you can give the vaccination, cholera vaccination, which is a passive type of vaccination. Cholera vaccination is not active. It is not, so it is a type of passive vaccination. Means when the cholera outbreak occurs, then only you can take the cholera vaccination. 2 doses are taken of the 4 to 6 weeks interval, and you can repeat that dose after 6 months because its duration of action is very short. So this concludes the today's talk.